it's going to haunt me.
The policy comes after incidents involving patients like Reuben St. Charles. The Métis man's braid was cut off without his consent during surgery at Saskatchewan's Royal University Hospital last year.
My ponytail was gone, and I started screaming.
In a newsletter to staff obtained by CBC, the SHA says its Indigenous haircutting policy requires team members to engage in culturally responsive and trauma-informed practices that align with the Workplace Expectations Policy, Culture of Safety Policy, and Indigenous Cultural Responsiveness Policy. And the SHA's Vice President of First Nations and Métis Health encourages staff to review and understand it. The policy only requires haircutting for medically necessary or life-saving brain injuries and head traumas, what the SHA says is extremely rare instances. If it has to be cut, it must be documented and returned back to the patient. Staff who don't follow protocol could face discipline under union agreements or even be fired. One former patient advocate is hopeful about the change.
So on one hand, I'm delighted that we have it. On the other hand, I'm saddened that it took this long. More importantly, let's hope it's not tokenism and that actions will actually follow.
Marwood says, while the policy focuses on Indigenous cultural practices, the respectful treatment of hair matters to many people.
But it's also important to, let's say our Sikh relatives or, so they've made it Indigenous slanted, but it's important to all citizens.
The policy's success will now depend on how well it's enforced, not just on paper, but in everyday practice. Sarah Onyango, CBC News, Regina.